there, dear. How have you been feeling? Okay. Okay. And how has the pain been? Have you been okay? Okay. I have been watching your vitals since you dozed off for a little bit, but it is time for your checkup. Welcome to the clinic. I know you had a bit of a tumble, but I'm glad you're here now and you're safe. I am the night nurse. My name is Nurse Dreams, as I tend to make people fall asleep. Perfect time though, because it is the night. So, based off of your sheet here, I'm going to be performing a couple simple, just very basic examinations on you. Going to be looking and treating those wounds, taking your heart rate, asking you how you've been, cleansing the areas that I need to move you around a bit. You know, everything to make you feel more comfortable, okay? Good. Before we begin, can we double check your name? What's your name, dear? Okay. Perfect. And what is your address of residence? Okay, give me a second. Okay. And is your pharmacy the same as last time? Okay, thank you. So, enough with the questions. First, I'm going to be looking into your eyes as you had a bit of an impact on your head. And I'm going to ask you a couple simple questions. Just look at me dead on, okay? I'm just going to be looking into your eyes, and I have a bit of a flashlight here that I'm going to shine very quickly 3 times into this eye and 3 times into the other, okay? You just keep looking at me, okay? Good, thank you. So just going to cover that side. Just quick. Okay. That one didn't seem to dilate too much, but that's also where the impact is. Okay, the other side now. It's going to cover this eye really quick and okay. That one seemed to be good. Thank you. And I'm going to write that down too. Now, very silly it sounds, but follow through with me. We're going to play a game called How Many Fingers Am I Holding Up? So, how many fingers is that? 2. How many fingers is that? 3. Fingers? 1. Fingers? 5. Okay. So, now I'm going to just be taking your heartbeat, if that's okay. Good. So, we have you hooked up, but I always double check because sometimes the machine can't get what I can, so it's going to be a bit cold. I apologize. I'm going to place this on your chest, so please pardon my reach, but I'm just going to place that on your chest now. What I want you to do is take a couple deep breaths, okay? Just in and out. Really simple like that, okay? Good. Just follow through with that in and out. Thank you. Now, let's hear. and to the other side really quick. Just in and out. Okay. Now I'm going to test it onto your neck. So, just really quick. In and out. Okay, that was good. That was also analyzed onto my computer. I felt nothing strange there. Sounded very good. Next, I'm just quickly going to be looking inside your mouth. Gonna pull the light back here. You impacted your head from a fall, and your jaw seems to be a little bit injured as well, so I'm gonna take a look inside with a bit of a tongue depressor. So please open your mouth really quick, dear. Thank you. Just going to shine the light in. Just gently taking a look inside. I hope that's not bothering you. Just looking inside. Okay. Just a bit of swelling as you were injured, but that's normal, okay? Good. What we're going to be looking at next is, I have this fancy, kind of old school thermometer, but may I please place this under your tongue to test your temperature? Sometimes with impact, it can cause the antibodies to work a little bit harder. So, just kidding. Okay, let's see here. 96.9. That's good. Very normal. Let me quickly write that down on my paper here too. So just grabbing. Okay. Good. Now I'm going to ask you, if I may, just press around your face, okay? Yeah. I'm gonna get another pair of gloves on for this, as to not disturb your wound. We will treat that after I look around your face. I'm going to ask you to move your face around a bit as to assess your nerves. So, first I'm just going to place it around your face here, just a bit close. And now, can you just clench your jaw? Okay. Okay. And clench your jaw. Okay. Now going to press around the eye areas, just gently. So, just gently going to press around the eye areas. It just appears to be a bit swelling, that's why. And does any of this hurt at all, or are you okay? You seem to be slowly falling asleep, and that's okay. If at any point this feels uncomfortable, please let me know. It will help me better take care of you, okay? Okay. And again. Okay. Now I'm going to get into an area that might hurt a bit. As you were injured right at the top, I'm going to just take care of that area. So, looking at the wound area, I'm going to press around. Let me know if it feels extremely uncomfortable or if you feel something that doesn't feel right, okay? press around the area. It's a pretty bad wound, but that's okay. It will be taken care of. Okay. A full assessment of that would probably be a very intense impact. So I'm just going to press around, and I really need to clean that again. You appear to already have had proper care of this prior from your physician, but just looking at the area. Okay. You also have a couple wounds on your cheek. I'm just going to press around that area. So no pain. Okay. So just okay. I'm going to write what I just saw down. We're going to do a deep cleansing of that area. It appears to be getting a bit swollen, which just requires extra care. Okay. We're then going to bandage it after so that you don't have to deal with looking at it. And we're going to watch you overnight, so nothing that we can't take care of, okay? I'm going to start first with a clinical formula of an iodine solution, very similar to what you'd see in some sort of surgery room, but this is just very thorough cleansing. It is a clinical formula with iodine and a bit of squalene so that you do not scar. So I'm actually just going to directly drop that onto the area. Okay. So just getting a bit close here. Okay. We're gonna let that sit while I apply another ointment to stop with pain. I have a fluid here, which is an anti-pain fluid. I'm going to apply that onto a bit of a round here. Just going to apply a bit of that and going to just gently tap it on the area. So just going to press very gently. Okay, we're going to apply that to the other parts of your face as well that had some sort of injuries. So down here at the cheek. You appear to be getting sleepy. That's okay. And to the other side next to your jaw. I was reading that it was a skateboarding incident. I love skateboarding and longboarding, so I understand, but you need to wear a helmet next time. And please be aware of the things surrounding you, okay? Good. Trust me, we want you to be as safe as possible so you can feel like you again, okay? How's that feeling? Like nothing at all. Great. I'm going to move on to a more vigorous cleansing solution now. I have a cleansing pad with a very astringent cleansing solution. And I'm going to also add an anti-inflammatory to it so we can reduce the swelling. So I've got this anti-inflammatory. Just okay. Flipping with the bottle here, just going to apply a bit of that to the solution. Okay. And I'm going to gently press it on the area. If at all this hurts, let me know. But we're going to take care of this with as much care as we can. So just mixing that around. How are you feeling? Much better. A little smile on your face and closed eyes is always something that lets me know that something good is going on, okay? Yeah. Sleep is so good for healing. So okay. We're going to apply this to the other parts of your face now. And then I'm going to wrap you up, okay? Good. We're going to put compression on the area on your head. And to the other side now. This is when, yeah, you flinched. Okay. Just making sure. Okay. That's good. Now we're going to apply a compressant to particularly the wound on your head. I have this compression pad. And with this compression pad, I'm just going to apply it really quick. Just to get it onto the area. Okay? Try not to move, dear. And just going to take the wrap. We're going to wrap it around your head. So okay. Don't move. I'm gonna just wrap it around you, okay? Okay. You seem to be getting sleepy now, which is my cue that something good happened. I'm gonna write down what I did today. And before I let you doze off to sleep in this ward, I'm just going to move you around a bit, shift you around so you do not get any sores on your body. So I'm just going to push the arm a bit. Just move your arm and lift it up. I'm going to just reach to your hip and lift your hip up, and the other side as well. So just going to lift the hip up. Okay. And to the other side now. Okay. You getting cozy there? Good. So I'll be back in a couple hours to check in on the wound, but you go to sleep now, okay? Have a good snooze, dear.